A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. My name is Sayyida Fatma Hassan, and today I am going to present my presentation about complete blood count, differential leukocyte count, and blood smear test. First of all, we are going to recite Surah Kahf, Holy Verses, ayah number 55 till 56. Bismillahir rahmanir rahim. और नहीं भेजते हम रसूलों को मगर खुशखबरी देने वाले और डरसाने वाले, और झगड़ा करते हैं वो लोग जिन्होंने कुफ्र किया बातिल की मदद से, ताकि नीचे कर दें उससे हक को, और बना लिया है इन्होंने मेरी आयतों को और वो जिससे इनको डराया जाता है हंसी मजाक। इस आयत में खुदावंद ताला इरशाद फरमाता हुआ नजर आ रहा है कि खुदा ने रसूलों को हमारे लिए खुशखबरी देने वाला और आगाह करने वाला बनाकर भेजा है। इस आयत में उन लोगों की जानिब इशारा किया जा रहा है जो कुफ्र के जरिए से दीन को नीचे कर देना चाहते हैं, और ये वो लोग हैं जो खुदा की मुबारक आयतों का मजाक उड़ाते हैं और उसको हंसी मजाक में रायगा जानते हैं। हजरत अबू हुरैरा से रिवायत है, रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम से रिवायत करते हैं कि आपने फरमाया, कसम उस ज़ात पाक की जिसके कब्ज़े कुदरत में मोहम्मद सल्लल्लाहु अलैहि वसल्लम की जान है, इस उम्मत का यानी इस दौर का जो कोई भी यहूदी या नसरानी मेरी खबर सुन ले, यानी मेरी नबूवत और रिसालत की दावत उस तक पहुंच जाए और फिर वो मुझ पर और मेरे लाए हुए दीन पर ईमान लाए बगैर मर जाए, तो जरूर वो दोज़खियों में होगा। इस आयत में जिस शख्स को आपकी नबूवत और रिसालत की दावत पहुंच जाए और वो आप पर ईमान ना लाए और आपके लाए हुए दीन को अपना दीन ना बनाए और इसी हाल में मर जाए, तो वो दोज़ख में जाएगा, अगरचा वो किसी साबिक पैगंबर के दीन और इसकी किताब और शरीयत का मानने वाला कोई यहूदी या नसरानी ही क्यों ना हो। अलगर्ज खत्मुल अंबिया सल्लल्लाहु अलैहि वसल्लम के बाद आप पर ईमान लाए और आपकी शरीयत को कबूल किए बगैर निजात मुमकिन नहीं। हाँ, जिस बेचारे को आपकी नबूवत की इतला और इस्लाम की दावत ही ना पहुंची हो, वो माजूर है। Now I am going to present my presentation about complete blood count test, differential leukocyte count, and blood smear test. First of all, we are going to study what is CBC. CBC stands for complete blood count. A CBC is a blood test used to evaluate an individual's overall health and detect any inflammation present, a wide range of disorders, infections, and deficiencies by providing information about blood cells that are red blood cells, white blood cells, and platelets. So what does a CBC test includes? Number 1. Red blood cell count. The total number of red blood cells present in a blood of an individual. Now what are red blood cells? Red blood cells are non-nucleated cells that carry oxygen from the lungs to throughout the body and carbon dioxide from the body to lungs. Number 2. Hematocrit. Hematocrit is the volume percentage of RBCs in blood. This test indicates the number of red blood cells in a given volume of blood. MCV stands for mean corpuscular volume. In this test, we measure the size of RBC. MCH. MCH stands for mean corpuscular hemoglobin. Through CBC, we measure the amount of hemoglobin in an average red blood cell. Number 5. MCHC. That stands for mean corpuscular hemoglobin concentration. Through CBC, we measure concentration of hemoglobin in an average red blood cell. Number 6. Hemoglobin. CBC measures the amount of hemoglobin in an RBC. Now what is hemoglobin? Hemoglobin is a substance present in the RBC that is responsible for carrying oxygen. Number 7. Platelet count. Platelets help form blood clots. Their number in blood count is given as platelet count. Now in this chart, you could see the blood cell or substances that are having different levels in an healthy person. Number 8. Mean platelet volume, MPV. In this, we measure the average amount of platelets in the blood. Number 9. White blood cell count. WBC stands for white blood cells. These cells protect our body against infection. their number in blood is given as WBC count. Now, what is the function behind the conduction of CBC test? Number 1, to identify inflammation, to identify infection, for diagnosis of anemia, acute and chronic illnesses, WBC-related disease or deficiencies. Number 4, monitor treatments. Number 5, look for any side effects for treatment. Now, when is a CBC test performed? Following are some symptoms that indicates that a CBC test should be performed. Number 1, bruising or bleeding. Number 2, fatigue, dizziness or weakness. Fever, nausea and vomiting. Inflammation, that is the swelling and irritation anywhere across the body. Now we will discuss how is the test performed. Number 1, take a tourniquet. Tourniquet is an elastic band that is placed around on the upper arm of the subject, above the elbow, which causes the vein that carrying the blood to swell with blood due to pressure exerted by the elastic band. Now a needle is inserted in the vein and blood is collected in the syringe. The tourniquet is later removed. Now remove the needle from the subject. The blood is then sent to the laboratory for further testing. An automated cell counter counts the different cells and displays the result. This is a modern technique for the conduction of CBC test. Now we will discuss the old method of performance of CBC test. All these steps are same except the steps 1 till 5, they are all same. Just the difference is that instead of an automated cell counter, we complete blood count test performed manually by using microscopes. We can determine the presence of white blood cell, red blood cells and platelet counted using microscope in old method of CBC test. What does abnormal CBC test results and what they indicate? Number 1, low RBC count. The symptoms are anemia, acute or chronic bleeding, bone marrow problem, deficiency of RBC forming factors, kidney disease or liver disease. Number 2, high RBC count. Symptoms are increased hemoglobin, dehydration and some diseases. Number 3, lower hematocrit. An insufficient supply of healthy red blood cells, anemia. A large number of white blood cells due to long-term illness, infection or white blood cell disorder such as leukemia or lymphoma. Number 4, higher hematocrit. Symptoms are dehydration, a disorder such as polycythemia, lung or heart disease. Number 5, increased WBC count. Symptoms are excessive infection, leukemia. Number 6, lower WBC count. Symptoms are that might result due to certain therapies. Number 7, higher MSC level that indicates macrocytic anemia. Number 8, lower MHCH. Symptoms are blood loss, iron deficiency or microcytic anemia. Number 9, lower MCHC levels, hypochromic microcytic anemia. Number 10, lower hemoglobin levels. This indicates reduced ability of bone marrow to produce RBCs, bleeding, malabsorption of iron, or deficiency of vitamin B12 and B9. Number 11, higher hemoglobin. This indicates polycythemia, cancer, heart, lung, or kidney, liver diseases. Number 12, higher platelet count. This indicates inflammatory conditions like autoimmune diseases such as cancer or trauma, infections, or iron deficiency. Number 13, lower platelet count. Condition that causes blood clot such as TTP, that stands for thrombotic thrombocytopenia purpura, and DIC, that stands for disseminated intravascular coagulation. Or infections from bacteria and viruses can lower your platelet count for a while, such as dengue virus. Number 14, higher MPC, that indicates thrombocytopenia, myeloproliferate disease or blood cancer. Number 15, lower MPC. This indicates aplastic anemia. That's all for CBC. Now we will discuss DLC. DLC stands for differential leukocyte count. It is a test that measures relative proportions of different types of WBCs in the blood expressed in percentage. What are WBCs? WBCs stand for white blood cells. These are the fighters of the immune system. They help maintain immunity and combat diseases that occurs in our body. This is a chart that shows the different types of white blood cells present in our body, according to granulocyte presence and agranulocytes. Now, why is a DLC test performed? DLC test is performed when diagnosing the cause of high WBC count result seen on a CBC, or to check for a disease that affects the WBC's count. That's all for my part. Thank you for your precious time. Thank you.